In this video, we're diving into an often overlooked connection, the link between your feet and your heart as health. We'll walk you through steps you can take to safeguard both. So let's dive in. Did you know your feet can reveal how well your heart is functioning? From nerve pain to wounds that don't heal, your feet often send subtle alarms when something's wrong with your heart. Hi everyone, I'm Naeem. And in today's video, we'll explore the surprising connection between cardiovascular health and foot issues, and what you can do to protect both. We've all heard about the importance of checking our heart health, but did you know that your feet can also provide valuable insights? Every beat of your heart pumps life-giving oxygen and nutrient-rich blood into your arteries, which branch out like roads throughout your body. Your feet, being the farthest extremities, rely on these arterial highways to receive their supply. But what happens when there's a traffic jam somewhere along the way? Let's talk about that. When circulation falters due to conditions like heart disease or peripheral artery disease, PAD, foot tissues may suffer from a lack of blood, oxygen, and nutrients. This can lead to discomfort, pain, numbness, tingling, and even wounds that heal more slowly than usual. Understanding the intricate connection between your heart and feet empowers you to spot potential problems earlier and seek timely solutions. In this video, we'll delve into common foot issues that might signal underlying heart concerns and provide practical advice on what you can do to stay on top of your foot and heart health. Okay, now let's look at some warning signs to watch for. When it comes to your feet, there are some telltale signs that might indicate trouble in circulation town. Here are some things to keep an eye on. First, cold or bluish feet, even in warm weather. Does your footwear make a difference? Are your feet consistently colder than the rest of your body or appear bluish in color, even when you're in a cozy environment? If so, you might be experiencing poor circulation. Next, persistent foot or leg swelling. Do you notice any unusual puffiness around your ankles or lower legs? Swelling can sometimes point towards a buildup of fluid and potential circulation issues. Also, numbness, tingling, or burning sensations. Are your feet sending you pins and needles or a tingling vibe? These sensations could be your feet's way of saying they're not getting enough blood flow. Next, sores that don't heal or toenails becoming thick and brittle. Slow healing wounds or changes in your toenails might seem unrelated, but they could hint at circulation problems. If you notice these issues, it's essential to consult with your doctor right away. These could be warning signs that your heart or blood vessels aren't functioning optimally, leading to reduced blood flow to your feet. By staying vigilant and addressing such symptoms promptly, you can potentially prevent more serious complications down the road. Remember, it's always better to err on the side of caution when it comes to your health. Let's take a moment to meet one of our clients. The road to understanding the connection between heart health and foot issues led us to meet an inspiring client named David. Through his journey, we've gained insight into the crucial role of early detection and proactive care. David's story highlights the significance of addressing seemingly minor foot concerns, especially in older adults or those with pre-existing health conditions. His experience serves as a reminder that proactive care can make a significant difference in managing foot and heart health, preventing potential complications, and improving overall quality of life. By sharing David's journey, we hope to empower more individuals to prioritize their health and seek timely medical attention when it comes to any unusual or persistent foot issues. Now let's move on to segment 4. You may be wondering, what is PAD and why should I care? Well, let me break it down for you. PAD stands for peripheral artery disease, and it's like a little roadblock in your arteries. Imagine your arteries as roads that carry important supplies like oxygen and nutrients to your body's different parts. Now picture these roads getting narrowed or blocked because of plaque buildup, kind of like traffic jams. This blockage happens in the arteries that supply blood to your legs and feet, which means your feet and lower legs might not get the full supply they need. This condition primarily affects people over 50. And here's a quick fact for you. About 10 to 15% of folks over 50 have it. And guess what? Many don't even know they have it. That's why it's essential to understand the symptoms and risk factors. With knowledge, we can take action to keep our feet and our hearts happy and healthy. Here are a couple of questions you may have about PAD. What is it? Well, it is a condition where the arteries that supply blood to your legs and feet get narrower or clogged, which means your feet don't get the right amount of blood they need. And why should you care? Because it's not just about your feet. PAD is linked to other stuff like heart attacks or strokes. Plus, it's a sign that your heart and blood vessels might not be in tip-top shape. Basically, taking care of your heart also means taking care of your feet. Now, let's dive into the nitty-gritty of PAD. What exactly causes this arterial blockage? Picture this: inside our arteries, there's a layer called the endothelium. Think of it as the smooth inner lining of the road. But sometimes this lining gets damaged, and when that happens, plaque starts forming. Plaque is like a buildup of stuff that shouldn't be there, including cholesterol, calcium, and other substances. Over time, this plaque narrows the arteries, slowing or blocking the blood flow. And the worst part, it can happen in multiple places, making the traffic jam even worse. This narrowing of the arteries restricts the blood flow, and when it comes to your feet, that's not good. They're at the end of the road, so to speak, and they rely on that blood flow to get the oxygen and nutrients they need. When the flow is restricted, your feet might not get what they need to stay healthy. It's like trying to use a tiny hose to water a huge garden. It just doesn't work efficiently. The reduced blood flow can cause all sorts of issues, from cramping and numbness to slower healing of wounds. It's like your feet are sending SOS signals, and it's our job to listen and take action. But here's the kicker. PAD is sneaky because it might not show symptoms until the blockage is pretty significant. And even when it does, those symptoms can mimic other conditions, making it tough to spot. That's why regular checkups with your healthcare provider are so important. They can help decipher the clues and guide you toward the right treatment. Remember, it's not just about age. While it's more common as we get older, it can affect younger folks too. And it's not one size fits all. People with certain risk factors might be more susceptible. Risk factors include smoking, high blood pressure, diabetes, and a history of heart disease. Knowledge is power, so don't hesitate to ask your healthcare provider if you have any concerns. They can help assess your individual risk and suggest ways to keep both your feet and heart in tip-top shape. Alright, now let us talk about what you can do to keep both your feet and your heart happy and healthy. Taking care of your feet is a lot like taking care of your car. Regular maintenance goes a long way. So first, daily self-care practices. Inspect your feet every day. Look for color changes, swelling, or sores. You know your feet best. If you notice anything unusual, don't hesitate to give your healthcare provider a call. Perform gentle exercises like ankle rotations and toe stretches to boost circulation. These simple moves can get the blood flowing and help reduce the risk of clots. Wear properly fitting shoes and replace them regularly. Shoes that are too tight can restrict blood flow, so choose wisely. And hey, don't forget to moisturize, but keep the skin between your toes dry to prevent infections. If you're diabetic, monitor your blood sugar closely. High sugar levels can damage nerves, leading to neuropathy. Keeping your blood sugar in check is a game changer. Next, lifestyle recommendations. Stay active. Brisk walking, swimming, or cycling not only benefits your heart, but also gives your feet a good workout. Aim for at least 30 minutes of moderate exercise most days of the week. A heart-healthy diet is your secret weapon. Focus on fiber-rich foods, lean proteins, and healthy fats. Load up on fruits and vegetables packed with vitamins and antioxidants. And don't forget to limit saturated fat and added sugars. Quit smoking. If you're a smoker, this is your sign to quit. Smoking narrows your blood vessels, reducing circulation to your feet. There's no better time than right now. Finally, medical advice. Don't skip routine podiatric and cardiovascular checkups. Early detection and treatment can prevent bigger issues down the road. If you have symptoms like non-healing foot ulcers, absent foot pulses, skin color changes, and cramping during walking, talk to your healthcare provider about vascular testing, such as the ankle brachial index or ABI and Doppler ultrasound. These tests can help identify PAD and other vascular issues that might be lurking in the shadows. Remember, knowledge is power. The more you understand about your feet and heart health, the better equipped you are to take care of them. So don't hesitate to ask questions, seek professional advice, and make positive changes. Your feet will thank you for it. We hope you found this information helpful. If you enjoyed the video, please give it a thumbs up. And don't forget to subscribe to our channel for more insightful health videos. Thanks for watching. Stay healthy and take care of your feet because they're taking you places.